Hello and welcome to this edition of Wake Up and Live with the Arts. I'm Sue Johnson here with James McGilvray, our videographer, to welcome our special guests this evening. And we are excited to welcome back Dr. Charles Modlin of the Cleveland Clinic Foundation, where he is a rather important person, but he is here primarily to talk about the upcoming Men's Health Fair scheduled for April 11th at the Cleveland Clinic Foundation, and he's brought a special friend with him, Jerome Davis, who took advantage of attending the Men's Health program a while back, and thanks to Dr. Modlin, Jerome has a special story to tell. So welcome, both of you. And Charles, it's good seeing you. And as I said when you came in, we finally captured you in time.
I wouldn't miss this for anything. I'm really appreciative to be able to be here.
Well, we'd like to help showcase what our folks are doing and contributing to the community. So tell us now about this year's Men's Health Fair. Who's it for? Why is it for them? How does it work?
Okay. Yeah, pleased to do so. So this is our 17th annual Cleveland Clinic Minority Men's Health Fair.
And I notice it's minority, so let's be sure we talk about that a bit,
too. Sure. So, it's minority because we're trying to target especially African American, other minority males, because these individuals have a higher incidence of what we call healthcare disparities. Mm-hmm. But I always want to point out that the health fair is open to everybody. You don't have to be a minority. Cleveland Clinic would never host a program just for minorities
a special group
for a special
only.
Group. So that first and foremost, everybody's invited. Every
Does that include women too?
We've had some women come get their blood pressure checked, things like that. But we really need to take a responsible approach to helping improve the health of the communities. And the observation is, you look at African American men. Live on average about 6 to 8 years shorter life expectancy than white men. Mm-hmm. And then we've delved into the reasons why. A lot of it's because of healthcare disparities. Some examples of the disparities: African American men take prostate cancer, for example. Black men develop and die from prostate cancer twice as often as white men. And there's something that we can do about it. If we can detect the prostate cancer in early stages, we as urologists have the potential to potentially cure the cancer in almost 100% of the cases. And, we're finding out there are some situations nowadays where if it's a low-grade, low-stage cancer, we actually can just observe it. But, there are a lot of men who actually present in late stages, and then it's really kind of too late to really cure the disease. Higher rates of diabetes, high blood pressure, heart disease, kidney disease. Black men, once they have a stroke, they have twice the incidence of death from strokes. So these are the disparities that we're actually trying to address, and that's why it's
and help counteract.
Oh, exactly. And, and we at the health fair, we not only do provide for a lot of these screenings, but we also educate the men about how to better take care of themselves so we can prevent these conditions. And we want them to go back and educate their families and their other communities to get them to empower them to take advantage of the health fair and undergo these screenings themselves.
Now, this is an all-day event, and it's free and open to the public, and the attraction is primarily for minority and or African-American men who do not take care of themselves necessarily the same way as other folk. Sure. And would you speak, before we have you introduce our guest, a little bit about perhaps the fears, the stigmas, the I'm less manly aspect of why so many minority men just don't get the health care they need? Sure.
So actually, the health fair is going to be this year on April the 11th. Mm-hmm. It's a Thursday evening, but between the hours of 5:30 p.m. and 8:30 p.m. We have about 450 volunteers, all these Cleveland Clinic departments and doctors and nurses and caregivers ready to provide these screenings. And I just want to make one special note is a lot of times people think when we talk about health disparities that we're talking about just one group of unemployed or disadvantaged individuals, but actually even affluent African Americans, Hispanic, Latinos have healthcare disparities.
Yes.
Higher rates of prostate cancer, diabetes, and so on. A lot of it is genetic. It's hereditary in many situations. Not all situations. sometimes it's dietary. There are a number of factors that go into lifestyle. But one thing that we do see, especially in men of color, there's a fear a lot of times that men of color have in terms of not wanting to go to the doctor. My own father, he never really wanted to go because he was afraid that the doctor might find something. And again, I'm here to tell the guys that a lot of times it's better if we do find something earlier. We don't want to find anything.
Right.
We don't want anything to be there, but if there's something there, we can actually help you if we can find it in early stages. A lot of men think that if they come and if they're diagnosed with prostate cancer or some condition, and if they have surgery, that's going to impact their ability to function as a male.
Their sexuality. And impotency and things of that sort.
Yeah.
Yes.
And see, I'm glad you said it. But no, they think that's going to be impacted, and there's in many situations it may be when you talk about prostate cancer. But I can tell you there are things that we can do about it to
nowadays
to treat those conditions. If they do occur. It's interesting. I was at a seminar hosted by Reverend Dr. Marvin McMickle. This is several years ago.
Yes, yes. He was famous here at Antioch as the leader of Antioch Baptist Church.
And you stand next to him, he's like
9 feet tall.
But he himself wrote a book about surviving prostate cancer. And there was one of his parishioners in the audience, and I was sitting there listening. He goes, "Well, Pastor, I'm afraid if they find out I have cancer and they treat it, I'm going to lose my nature." And then Reverend McMickles, he looked down as tall as he is. He goes, "Well, son, last I heard, nobody's having sex in the cemeteries."
He was a man of. He is a man of humor.
Oh, absolutely.
Yes.
But he said it correctly. It's all about living. It's all about living. We're conducting the health fair. We're trying to get across to the men, and our theme this year is because you matter. We're doing it because you matter.
Yes.
And they need to take advantage and undergo the screenings because they matter. They matter to their family, their friends, their communities. Oftentimes when we meet, men of color, black men, they've been told or they've assimilated it into their thought process over the years that whatever happens to them doesn't matter.
Yeah, they've been enculturated, like so many of us, whatever it's been about, we've been enculturated to believe the false truths.
Exactly. But they matter, do it because you matter.
And speaking of somebody who matters, we have a living witness to that. We have Jerome K. Davis, is it? Yes. Welcome, Jerome. It's my pleasure, our pleasure to meet you.
Thank you.
And have you be a living testimony to the Men's Health Fair that which one did you attend at some point?
2012.
2012.
Yes.
And what happened at the health fair for you?
Well, my mom passed away of colon cancer, and my father lymph node cancer in the groin area. And in 2001, my mom was 85. So anyway, I tried to keep up with myself, and my wife would make me go, and I would try to keep up and go get my colonoscopy and just try to stay on top of it.
General health care treatment.
And I'm gonna lie, I fell off a few times, and so I have satellite radio, and I was at work one day and I heard about the Minorities Man Health Fair, and let me go check that out. So I went to it, and I met Dr. Modlin. Well, I went to the fair and I met him, and after I got checked, they wanted to see me. So I went and did a biopsy, saw that I had it, and
had prostate.
Yes, I had prostate cancer. Yes, it was really, really
early,
very early. He called it super early. And if I had not went to the health fair, I wouldn't have known about it. So thank God that Dr. Modlin had this going, and I even had medical insurance. I had medical insurance, and I didn't go like I should. And I'm gonna be honest. I was like, ain't no man gonna stick their finger
up your rectum.
And a lot of guys like that, and they need to get out of that. Really, they do. And how my wife helped me with that. She said, "Will it help if I get a lady doctor?" I said, "Well, yeah, that might help, but but if whatever it takes."
Yes.
to go get yourself checked out. And like I said, I had medical insurance. I had very good insurance, and it was because of the health fair that I went and found this out. And then I had my surgery in 2014. I waited a year, got myself a little healthier, lost weight, worked out, tried to get my core a little tighter before I had the surgery. And I had the surgery, and it's a beautiful thing, you know. I suggest all men, black, white, Hispanic, Asian,
purple,
it
polka
doesn't
dot.
matter.
Yes.
You go get checked out because you want to live. You want to be able to see your grandkids. You want to be able to spend time with your wife. And if you know you doubt your manhood, don't worry about that, and don't be afraid. It's just, you know, you got to get over that afraid part, you know. And it's a beautiful thing. I enjoy going out with him, letting people know. I pass out the flyers. I just try to educate people as much as I can.
Yes.
And, you know, I get some people that turn me down. You know, we had talked about that. And other than that, it's just men need to go take care of themselves.
And you've been cancer-free since your surgery?
2014.
5 years.
Yes, February 2014.
Over 5 years.
Yes.
Now 5 years and a month or so.
Yes. Some folks be like, you're not looking that good. I was like, well, I caught mine early. I didn't need no chemo, no radiation. I just had the surgery.
Well, I'll just say one thing, just so your listening audience knows. We actually, if we're not going to force the men to have that prostate exam.
Right.
There's a blood test also we can do.
PSA.
PSA.
Yes.
So, I mean,
that's a standard test.
Right.
Our dad had it many years ago, and I remember we used to go to St. Mark's Presbyterian Church on East Boulevard, and Daddy called my sister and me over, and he let us know that his PSA was out of whack. They were going to monitor it for a while, and when it kept growing, he had the surgery, and all I had to do was change his bandage when he came home because Mama wouldn't do it. She couldn't do it.
But if I ask what year that was?
I don't remember. Heavens to Murgatroyd. That was back in the 70s or 80s.
So they did the PSA?
It was probably called acid phosphatase. But
his was called the PSA.
Oh, okay.
So whenever that was in history.
Okay.
And then now I understand they also have a procedure that involves the seeds.
Well, that's a treatment. There's different types of treatment. But like I said, I mean, if a man wants to at least come in and get the blood test,
yes,
I mean, at least do that.
And that's a start. Yeah.
So the treatments are surgery. That's surgically removing the prostate. There are different ways of doing that, either traditionally with a little open incision, or now we can use a robot to assist. And then there's external radiation. There's something called seeds or brachytherapy, pellets where we put into the prostate. Yes. But it all depends on the grade or how aggressive we think the cancer is. There are some situations now where we don't even have to treat it at all. We can just follow it.
Well, that's why what happened with our dad for as long as possible. But see, fellas, that they're options, and it's kind of an individualized approach, even though they have general procedures, tests, and so forth. But based on who you are, what your needs are, they can kind of customize a program, a process for you to go through to help you address and cure, hopefully, the prostate issue, along with all the other conditions you treat. Now, I'm going to raise a sensitive subject, and even though this is a family show, before we begin to close out. Now, how do men who would be part of, they got so many letters now, the LBGQTRSV.
They're all welcome also. They can come. Everybody's welcome.
Please let them know also that that men who, I forget their correct terminology.
It changes a lot, respectively, But LGBTQ.
That's the I don't know what
Q is questioning.
Thank you.
Somebody may not be certain.
Yeah, that's a fairly new one to me, and I've been having trouble figuring it out.
Yes.
Okay, so please proceed.
Oh no, but everybody is welcome. We don't discriminate. We don't shun. Open arms. Everybody, please come. I always say, where else in a 3-hour period can you go and physically, speak to, get examined by, get blood tests?
No charge.
No charge. It's all free. Free parking also. And see a primary care doctor. There's so many I can't remember. Primary care doctor, urologist, nephrologist.
Specialist in certain areas. Yeah.
Endocrinologist, otolaryngologist, neurologist, dermatologist, general surgeon,
cardiologist,
cardiologist, ophthalmologist, physical therapist, orthopedist, rheumatologist, podiatrist.
In other words, a totally comprehensive approach.
All there.
Yeah, it's all right there.
And the thing is, if you try to do that individually, it would take you at least 5 years. It'd take you probably $10,000 or more.
And you cover mental health also.
Mental health, I forgot to mention. Psychologists, psychiatrists, very important.
And men have a problem with that, but that's a whole other conversation, too.
And it's all there. I mean, you need to take advantage of it. Thursday, April the 11th, 5:30 to 8:30 p.m.
And which building?
It's going to be, actually, I forgot to mention, so we've always been at the main campus. Cleveland Clinic. Last year we expanded to Lorain Family Health Center out in Lorain County.
Yes.
And also Akron General Hospital. But this year we have a 4th location at Lutheran Hospital.
My word.
Yes. It's all simultaneously.
Oh, yes.
We have teams. We're basically trying to promote access, and we're touching more lives.
And that makes it easier so that you don't have the excuse about going downtown to 95th and Euclid and trying to park. Mm-hmm. And that you can go to area locations to get taken care of.
And I say the other most important thing is, I'm a urologist. Urologists are surgeons and physicians who specialize. We're specifically trained to take care of men's health.
Yes.
We take care of women also, but the kidneys, the bladders, the prostate, the male reproductive system, the bladder, urinary, voiding symptoms. And we can work with the primary care doctor. But I always say, every man needs a urologist.
Yes. And our dad had one.
And most women have a OBGYN. Mm-hmm. So every man should have a urologist because we're the ones that can best interpret what the PSA means, how to treat prostate cancer, the male, erectile sexual function. We do it all, but we work with the primary care provider. Every man needs a primary care provider in addition to every man needs a urologist.
Now, in the olden days, the primary care doctor was called the general practitioner before all the specialists came into being in the world. But if you are of an age where you still use the term general practitioner, that still means the primary care doctor who sees you on a regular basis, covers basic issues, and when it's beyond his purview or his means, that's when you go to your specialists, such as Dr. Charles Modlin of the Cleveland Clinic, urologist par excellence. And I want to thank, before we do thank Jerome, and he's got something to add.
Yes.
Contact information, phone number, website, email to get more information before April 11th.
Yeah. So traditionally, a lot of men, or most men, actually just show up on the day of the event and register on location. Mm-hmm. Main campus, Lutheran, Akron, and Lorain.
Yes.
But we do have a website. You can pre-register. If you pre-register, you can avoid the line. Then the line, it moves very quickly.
Moving.
But the website is ccf.org. Then /MMHF.
It's
a backslash. Yeah, so it's ccf.org/MMHF for Minority Men's Health Fair. Mm-hmm. You can register right there on the website, or like I said, just come in.
Well, also, if the wives and the women in the men's lives happen to see this and they want to get their fellows to your health fair's attention, that they can contact you to get more information as well.
And they can call my office, 216-445-7550.
And Jerome, to close us out, you wanted to add...
She mentioned earlier what building at the main campus. It could be the Glickman building?
The Glickman Tower, yes.
Glickman Tower.
Yes.
And I just want to add this here. Man, look here, it's free. You can't argue with free. Thank God and thank goodness for Dr. Modlin. And it's a lot of knowledge there, because I did not know, and I know a lot of people don't know also, that they have free medical grants if you have a life-threatening situation, which I had. And Dr. Modlin, come on here, I got you. I'm going to send you financial aid, and we'll take care of you. So, man, if you don't have medical insurance, please come down, get the free health screening, and they can take care of you. All in one ball of wax. You go right up there, and financial aid gets signed up, and you can get health.
But the health fair is free. You don't need any
right.
insurance
The health
or
fair
anything.
is free. You don't need no insurance. Yeah, right. I had health insurance, and I still went. And it was a good thing that I did go. That's how I found out at the 2012 health fair.
Well, and you go and get the information that you need. The event is free in all the locations and areas, again, to accommodate men, to make it easier for you to take care of yourselves, because, as Dr. Modlin says, you matter. And on that note, boy, what testimony, boy, what a great community service job you are doing. We are so proud of you and happy for the work you're doing on behalf of the men in the world and men of minorities, men of color, I like that expression, to help them better their lives. And I am so proud of you as a man who supports Dr. Modlin's work, and you're a living testimonial to the power of proper health care, diagnosis, treatment, and positive outcomes. So we will see you on April 11th from 5:30 to 8:30 at 4 different locations where you men can take care of yourselves. And with that, what we hope you will do, in addition to the health care, and this is all part of the same thing, be sure to wake up and live with the arts every day and get your health care. Till next time.